Okay, Dr. Jeremy here, in Nurse Medical here, and we're going to make a video. I didn't tell Brandy what the topic of the video is going to be, but Brandy, what have you been complaining about hurting?
My hip. It feels
Your
like
hip.
it pops out of my socket all the time.
I hear this all the time. Patients come in and they say, my hip is popping out of socket. It comes out, it goes back in, it comes out again. Your hip is not popping out of socket. It can feel like it. It's a really weird feeling. I've experienced it, lots of people experience it. It's called snapping hip syndrome. And what actually occurs is that the iliotibial band, which a lot of you have heard of, which is a thick band of connective tissue that runs from your hip down to your knee, that band is made up of two muscles. A muscle called the tensor fascia lata, which sits on the front of the hip, and then the glute max, which most of us know, which is on the back of the hip. Those muscles come together to form that iliotibial band. Well, right here, where those muscles come together and the band starts, is right here on our skeleton. It's this prominent bone called the greater trochanter. And what's occurring is that band of tissue is going back and forth over that bone. And it feels like the hip socket, or the hip actually comes out of socket. But I can assure you that's not what is happening. That is the only way your hip could come out of socket is if you were in a big car accident or you had some sort of big trauma. So as much as it might feel like that, it's actually an iliotibial band problem, and there are many ways that we can fix it, starting often with our physical therapy team. Got it?
All right.